Hi, I'm Crystal Gardner. I'm a family nurse practitioner in Washington, D.C.
And I'm Crystal Holmes, and I consent to this head and toe assessment.
Good afternoon, Crystal. My name is Bianca, and I'll be completing the head to toe assessment on you today. So first thing first, I'm going to start, and I'm just going to be taking a look at your skin, okay? I'm just going to be looking here, and I'm looking at the color of your skin, which is appropriate. Feeling the temperature, skin is nice and warm. Then I'll be checking for your skin tuber just to make sure that you're well hydrated, and you are. And then next, I'm just going to be looking for any lesions or rashes. Have you noticed anything on you at all?
No.
Okay, sure. Okay. Then now I'm going to do the same thing on your lower legs here, but I'm also going to be assessing for edema and see if you have any varicose veins as well, okay? So I'm just going to lift these up a little bit. Okay. No edema that I can see. No varicose veins. Again, your skin is appropriate, nice and warm. You have good skin tuber as well. Okay, good. So the next thing we're going to do, I'm going to take a look at your hands here. I'm actually looking at your nail bed, so we'll just say, looking at your cap refill. Okay, making sure that your nails are here to your nail bed, making sure there's no clubbing, and the overall condition of your nails, everything is fantastic. Okay, so now we're going to start. I'm going to work from your head and I'm going to work down. Okay, so I'll explain everything to you as I'm going through. If you have any questions, just make sure you let me know, okay? So I'm going to be starting here with your head, and I'm first just going to inspect, make sure everything looks symmetrical, no visible signs of trauma. I'm also going to look at your scalp, and I'm just inspecting for any parasites, any lice, and you don't seem to have any. Next, I'm just going to palpate, okay? Feeling for anything. Okay. Nothing I'm seeing. Can we just remove your glasses, please? Thank you. Okay, so next thing, I'm going to palpate your sinuses, okay? Let me know if you're feeling pain. Any pain there?
No.
Okay. What about there?
No.
Okay, fantastic. So, okay. Okay, so now that we've done that, okay, so the next thing that we're going to do is I'm going to look, I'm going to look at your eyes, okay?
Okay.
So first thing first, just close your eyes for me. And I'm just going to inspect, I'm going to be looking at your eyebrows, your eyelids, and your eyelashes. And open your eyes for me. Okay, now I'm actually looking at your eyes. I'm looking at your corneas, your pupils, just making sure your external structures, okay? So the next thing that I'm going to do here is I'm actually going to look into your eyes with my otoscope, okay? So there's a couple of things that I'm going to be looking for. So just look at me, and as I'm looking, I'll explain to you what I'm looking for. I'm going to be making sure that there's no red reflex. I'm looking at your lens clarity. I'm also looking at your retina background, your retina vessels. Just making sure everything looks good. Okay, fantastic. So then also here with your eyes, we're going to discuss some things. So I'm going to talk to you about the Snellen test and another test called the Rosenbaum test. So we're not actually going to do these tests today, but they both test for vision. So your Snellen test is going to test for your vision that's far away. And then the Rosenbaum test will test for your vision close up and reading, okay? Next thing I'm also going to do is I'm also going to shine this light into your eyes here, and I'm just making sure that this light that I can see in both your eyes equally, in which I can. Okay, I'm also going to look at your pupils, your reaction to light. Looks great. Okay. So then the next thing we're going to do is I'm going to check your perpendicular vision, okay? So what I'm going to do is I'm going to move this object here to both sides. And when you can see the object, you let me know, okay? Okay.
Yes.
Okay, so this time, same test, but I want you to cover one eye for me. Okay, so I'm going to see, so I'm going to be on this side, but I want you to let me know when you see it over here, okay? Not yet?
Yes.
Okay, fantastic. Can you switch for me? All right.
Yes.
Okay, fantastic. Okay, so the next thing we're going to do, I'm just going to get you to follow my finger, okay? Okay, fantastic. Great job. Okay, so we're going to move right along. So now I'm going to be looking at your nose. So now I'm looking at your nose, just going to be inspecting your nose again, making sure that it's symmetrical. I'm actually again gonna take an actual look up your nose, so hold your head up for me. I'm just looking at your spectrum, making sure everything looks good, making sure that your both nostrils are painted and they appear to be. So the next thing that we're gonna do, we're gonna test one of your cranial nerves, okay? So go ahead and close your eyes for me. So I'm going to place an object under your nose, and I want you to let me know by using your sense of smell what that actual object is, okay? Alright. Fantastic. And I'm sorry, Chris, I know we're doing head to toe, but when I was expecting your head there, I did forget to test for your other cranial nerves, okay? So we're just gonna do that really quick, I do apologize. Okay, so first thing I want you to do, I want you to clench your mouth for me really tight, like, Okay, good. Smile for me, frown, raise your eyebrows. Okay, fantastic. Okay, so next thing I'm gonna do, I'm gonna check your joint here. So I just want you to open your mouth really wide, like that, and then close, okay? So close it for me. Okay, go ahead. Close. One more time. Okay, fantastic. Thank you. All right, so now that we've done that, now I'm going to move and I'm going to go to your ears, okay? So first, I'm just going to be starting, and I'm just going to be inspecting your ears. I'm going to be looking at your oracles and your mastoid, just behind your ears. Okay. And I'm going to get my otoscope again, and now I'm going to be actually be looking into your ears, okay? And when I'm looking into your ears, I'm looking into your inner ear. I'm looking into your tympanic membrane, or also known as your eardrum. Making sure that looks fine. So then I'm going to do something called a whisper test. Okay, so how this is going to work is I'm just going to cover one ear, and I'm going to speak into your ear that's still open. I'm going to whisper to you, then I want you to tell me what I said to you, okay?
1942,
Fantastic.
73.
Okay, good job. Okay. So the last thing here, we're going to do a Rhine and a Weber test. Okay, so this is going to involve me using an instrument. So for the first test here, what I'm going to do is, I'm going to use this instrument, I'm going to make it make a buzzing noise, okay? I'm then going to place that object by your ear. When you hear that buzzing noise, let me know. I'm then going to place this object behind your ear. The object of this is to determine, do you hear the buzzing better in front of your ear or behind your ear, okay? So when you get the buzzing, just let me know.
Hear it.
Okay, and where'd you hear it better, in front of your ear or behind?
Hear it.
Okay.
Hear it. Front.
Okay, fantastic. So then the next test is called the Weber test. So same thing, but this time I'm going to hit it, and it's going to go in the middle of your head, and you're going to tell me, do you hear it better from the left or to the right, okay? Okay, we'll try again. You don't mind, I'm going to move this a little forward. Here's pretty. Okay, you ready? Okay, fantastic. All right, so now we're going to move, and we're going to move forward to your mouth. And so I'm going to start by, I'm just going to inspect your lip, which is fine, and then I'm actually going to take a look inside of your mouth. Okay, I'm going to use my, just say ah for me. So right now I'm looking at your uvula. Okay, then I'm looking on the sides of your mouth. You actually have two glands there that produce spit. So I'm going to, saliva. I'm looking at those, and then you also have a small structure here that connects your tongue to the bottom of your mouth, and I'm looking at that as well. Looking at your gum, your mucosa, and it looks nice and moist. Okay, so again, we're going to test some more cranial nerves. So what we're going to do this time, I want you to tell me your address.
247, please.
Fantastic. And then next thing I want you to take your tongue, go up and down, side to side. Okay, good job. So also, I'm not going to do this to you now, but typically in this test, they'll ask you to say ah, and they'll check your gag reflex, okay? So just know that for the future. Okay, so the next thing we're going to do is I'm going to look at your neck. Okay, looking, just making sure we have good range of motion. Not range of motion, making sure you're symmetric. Fantastic. The next thing I'm going to do is I'm going to palpate for your lymph nodes, okay? So you have lots of lymph nodes in that area, so I'm just going to feel. Making sure that none of those are swollen. Okay, fantastic. So then I want you to do is I want you to turn your head a little bit this way and lean forward. And I'm going to assess back here. I'm doing now, I'm sorry, is I'm checking for your cervical chains, okay? Bend and lean forward. Okay, fantastic. So now what you're gonna do, we're gonna test your range of motion. So I want you to take your head, I want you to go up and down, side to side. Okay, and then just kind of rotate your neck for me like that. Fantastic. Okay, so now what I want to do is I'm going to examine your trachea, okay? So first I'm going to feel here, your base, just to make sure your trachea is midline. And then the next I'm going to actually palpate your trachea. Okay, and what I want you to do for me, Chris, I want you to swallow for me. Okay, good. So now I'm going to take your head and pull it just a little bit, and now I'm going to palpate for your thyroid gland, okay? Okay, good. So the last thing we're going to do here is I'm going to feel for your carotid pulses, and I'm actually going to listen to them as well, okay? So we're also going to test for another cranial nerve here. So what I'm going to do is I'm going to get you to shake your shoulders and lift your shoulders up like this, okay? Now I'm going to try to push down on your shoulders, and the object is for you not to allow me to do that, okay? Okay, good job. Okay, so the next thing we're going to do is we're going to move on to your chest. So right now I'm just going to just breathe normal for me, and I'm just going to inspect your chest, looking at the rise and fall of your chest here, making sure that you're breathing normal, and you are. Okay. So the next thing I'm going to do is I'm actually going to take a listen to your lungs, okay? So I'm going to listen to your lungs in the front and on the back, okay?
Okay.
And each time just take a nice deep breath for me.
Where's the other one? You said what? You said light bulb? And what? Does she need two different kinds?
Okay, let's do it. Same thing, nice deep breath. Okay, fantastic. So the next thing I'm going to do here is I'm just going to percuss the back of your back here, okay? So just hold still for me, because you've got all this nice pretty hair. I'm going to do that. Okay. So the next thing I'm going to do is I'm going to place my hands on your back, okay? And when I place my hands on your back, I want you to just say 99 for me, okay?
99,
Again,
99,
again.
99.
Perfect. Okay, so then the last thing here is I'm gonna check for chest expansion, thoracic expansion. So just put your arms here by your side. So I'm gonna place my arms around you, okay? And what I'm looking for is for my hands to go in and out as you breathe, okay? So you just take a nice deep regular breath, and you may feel just a little bit uncomfortable from my hands, okay? Okay, fantastic. All right. Okay, so the next thing we're gonna do is I'm gonna listen. I'm gonna look at your heart. So the first thing I'm gonna do is I'm gonna look at your chest, make sure that there's no heaves, no thrusts, and it does not appear to be. I'm going to palpate for the maximum point of index. Okay. Deep breaths up. So the next thing I'm going to do, I'm actually going to listen, okay? So what this is going to, I'm going to listen to your heart at multiple points around your chest here. So it's almost going to be like I'm doing a small C around your breast area, okay? So now what I'm going to get you to do, I'm going to get you to lie back for me. Okay, so now I'm going to take a look at your abdomen, okay? So the first thing that I'm gonna do is I'm just inspecting, making sure that I don't see any bulges, no masses, no hernias. Take a peek at your belly button here, make sure that looks good and symmetric, everything looks good. Okay, so now I'm gonna listen for your belly sounds, okay? Next thing I'm gonna do is I'm going to palpate your belly here. So let me know if you feel any pain or any tenderness. That's fine. Okay, good job. So the same thing like I did on your back where I percussed your back, I'm also gonna do that to your abdomen here, okay? Okay. So the next thing we're gonna do is I'm actually gonna feel for a couple of organs, okay? So since I'm on this side, we'll start over here. So I'm gonna start with your liver. So I'm gonna percuss